Namaste. Today I'll be talking about kidneys and the significance of diabetes in renal issues. As all of you know, kidneys play a very important role in the excretion of toxins. But apart from that, they have many important roles in the body. One is hormone production. Erythropoietin is the one which is produced by the kidney, and it is extremely important for hemoglobin production. In renal issues, you see anemia because enough erythropoietin is not there and hence less hemoglobin. Number two is renin, and this renin hormone is extremely important for maintaining our blood pressure. Another important function of kidneys is electrolyte balance. So maintaining the electrolytes in normal level, as in your sodium, potassium and chloride, is extremely important for the body. Because high level of potassium which is observed in kidney diseases can lead to sudden heart attacks, heart blocks and so on. So that is another important function. Apart from that, vitamin D gets activated in the kidneys, and this is responsible for the calcium metabolism. So many important functions our kidneys play. Long-standing diabetes can lead to leakage of proteins in the urine, and the reason being glucose toxicity, as in high levels of sugar traveling in the blood which is carried towards the kidneys damages the nephrons or the basic framework of the kidneys, leading to leakage. So initially it is called microalbuminuria when small amounts of albumin is being leaked. In a normal person, it would be around 4 to 5 micrograms of albumin which is present, and in renal issues it could be much more. And in people with diabetes, slowly as the diabetes starts, within 10 years albumin starts leaking, and it is the natural progression of the disease. So anything more than 30 microgram, we call it microalbuminuria. And if the sugars are still high and microalbumin is not checked with medications, it can lead to what is called macroalbuminuria, or much more of albumin starts leaking in the urine. And here the macroalbuminuria will be more than 300 microgram. So this is the natural progression of the disease, and if it is controlled at the microalbuminuria level, it is definitely reversible. Certain medications used to treat blood pressure and many diabetic medications have been proved to prevent the progression of this microalbuminuria. Now I'll give you a brief understanding of what do we suspect. What are the early signs of any renal issues? As you know, since kidneys are the organs which are producing urine, any change in urinary frequency could be the first symptom. Initially, there would be too much of urine, frequent urination. Then at night times also you may have to get up and go to urine. And as the renal disease progresses, the urine production decreases, and thereby the urine frequency and the amount decreases. So the urinary output becomes less. And second thing is protein leak. As the protein is leaking in your urine, the urine will appear to be frothy. So even if you try to flush it, there are kind of froth or bubbles which are there. So that is something that you have to watch out for. And since proteins are leaking in the urine, there is not much osmotic pressure, what we call, to bind the water in the body. Not able to bind water, retain water in the cells. So it starts getting accumulated, and that leads to swelling. Usually periorbital edema or puffiness of eyes is very common. Even in legs, swelling can start developing. So this is another symptom of renal issue. Since calcium metabolism is also impaired because of inactivation of vitamin D, which is essential for the absorption of calcium, an array of metabolic changes occurs which can lead to hyperparathyroidism and so on, ultimately leading to lot of calcium being sucked off from the bones and getting deposited in the blood. So thereby bone pain, osteoporosis, brittle bones, fractures become very common. Now erythropoietin, which is important for hemoglobin production, is impaired here. So anemia will follow, and anemia can lead to lethargy, tiredness, easy fatigability, weakness, and so on. And in hemogram, the function of platelets are also kind of decreased, leading to easy bruisability. There is a small cut, immediately bleeding will follow, or gingival bleeding, gum bleeding. These are also symptoms of renal disease. Now, waste disposal. So, the urea, which is a metabolite, is getting out from the urine. And if at all it gets accumulated because of kidney disease, what happens is there is a lot of toxins accumulating in the urine, leading to many symptoms. One such symptom is pruritus, or itching in the body. Dry skin, small pimples, and feels like scratching all the time. That is called uremia. And if the uremia progresses, it can lead to uremic encephalopathy, wherein the brain functions are affected and leading to confusion, tremors of the hands, and so on. Other general symptoms include anorexia, as in you don't feel hungry, nausea, vomiting sensation, all because of the toxin buildup in the body, because kidneys are not able to flush it out. So these are the symptoms of renal diseases that you expect. And when it progresses, it can lead to fluid overload, because it is not excreting out your water and salt, leading to retention. And when that retention occurs in your heart, in your lungs, and so on, it can lead to breathlessness. And you may not also be able to sleep at night because of this fluid buildup. Another clinical marker is hypertension. As I said, kidneys are responsible for the production of renin, and this renin hormone leads to further salt and water retention and blood pressure. So in renal issues, blood pressure increases. So that is one of the first symptoms of kidney diseases. And the irony is that long-standing hypertension injures the kidneys. So thereby it forms a vicious cycle. Hypertension leading to kidney diseases, and kidney diseases leading to hypertension. So that is why in our practice we use a lot of medications to prevent this hypertension at the kidney level, so that in diabetics the pressures do not go high. You would have heard me saying this medicine is not for treating your BP, but for preventing renal issues. Then kidneys are not excreting. Even insulin doesn't get excreted from the body. So many times we have observed hypoglycemia or low sugar episodes occurring in patients with renal issues. So that is one of the very subtle symptoms of kidney disease. A well-controlled diabetes, a dose is set, but suddenly episodes of hypoglycemia. Definitely we must suspect something going on with the kidneys, because kidneys are not able to excrete the insulin. Thereby insulin is built up in the body, thereby leading to hypoglycemia. Now talking about the investigations. Kidney function tests are a group of blood investigations which are done to diagnose these issues early. In that you will see urea, creatinine, then you have your uric acid. They are all elevated in cases of renal issues. And apart from that, there is another test called glomerular filtration rate, or estimated GFR, eGFR, which has to be more than 90 in normal population. In early kidney disease per se, this eGFR starts declining. So that should actually let us know that the kidney function tests are declining. So there itself you have to start treatment so that further decline doesn't occur. Now microalbuminuria, as I said, it is important to estimate urinary microalbuminuria levels so that we understand where we stand in terms of the renal issues, and for the initiation of certain medications so that the progression could be prevented. Now another investigation is plain sonography of the abdomen and pelvis, wherein kidney, the shape, the size, architecture of the kidney is seen. Then if at all any stones or any calculi are present in the kidney, then a plain urinary examination would also let us know whether there are any pus cells or casts and so on in the kidneys. Pus cells as in there is some kind of bacterial infection going on there. We have to treat it immediately so that it doesn't ascend up to cause pyelonephritis or kidney infection per se. These small investigations throw light to a variety of conditions that is related to our kidneys. So early diagnosis and treatment is the best way to prevent these issues. Do your investigations regularly. At least once a year, renal function tests need to be done. A sonography need to be done so that any change could be picked up early. So to conclude, the purpose of this video is to make you understand early changes and whatever investigations could be done early so that these diseases are diagnosed much before they progress and treatment is started immediately so that we can avoid any further damage to the kidney. So take care and bye.